That's right. Last summer, support for mental health was funded in the state's budget at a historic level. And now we're seeing some of that funding come to life to the tune of a $20 million research grant.
Experts 10, 20, or even 30 years from now will look back on this moment, crediting the SOAR study for its life-saving advancements.
There is a new effort to research and remedy mental health issues across the state through something called the SOAR Network.
We believe Ohio has the ability to lead the nation in innovations in prevention, treatment, and recovery.
There's never been an effort of this scale, with this depth, in the history of addiction, mental health, and resilience research.
It's a decade-long research project led by Dr. Luan Fan at The Ohio State University in partnership with other universities across the state.
To explain what I feel are fairly simple but fundamental questions. Who gets ill? Why do they get ill? How do they get ill?
It will give us a complete picture of each participant to uncover why, for example, two people in similar circumstances or with similar health have very, very different outcomes.
Fan says there are 227 suicide or overdose deaths across the nation and 19 in Ohio every day.
Mental illness remains largely a mystery to our researchers, our clinicians, and because of that, the public.
The research project, in some instances, will go straight to people in all corners of Ohio, rather than having them come to an academic medical center.
To bring science and treatment to the people where they are at, where they live, where they work, rather than having them come to an academic medical center, which has, in some ways, made people reluctant to do.
Though the study will span over 10 years, researchers plan to publish findings each year and adopt any new initiatives they can in real time based on their results.
This study will provide key data that will shape the future of mental health across Ohio and beyond.
The budget also allocates millions of other dollars to other mental health services like the 988 Suicide and Response Crisis Hotline, which is receiving more than $40 million over 2 years. Local for you at the State House, I'm Natalie Fahmy, NBC4.